Hello, everyone. My name is Nita Gupta, and I am a pediatric emergency medicine physician at Children's Minnesota. Today, I would like to talk to you regarding considerations for children in your reunification planning. Whether you are a hospital-based operation versus a community, I hope you learn a few tips and tricks to incorporate children into your reunification efforts for the future. I am part of a larger nationally funded collaboration by the Department of Health and Human Services under the Administration for Strategic Preparedness and Response, also known as ASPR. I represent Minnesota along with my colleagues in our Center of Excellence that's called Region 5 for Kids. This Center of Excellence encompasses all 5 states in our FEMA 5 region, which includes Indiana, Illinois, Michigan, Minnesota, Ohio, and Wisconsin. And we serve over 3,000 pediatric beds with over 600 annual pediatric ED visits. ASPR actually has 3 nationally funded centers of excellence. FEMA Region 5 is one of them, but we also have our partners RAPM, which is our Western Alliance, and G7, which is Gulf 7 Alliance in the southern border. The red circles throughout the United States that you see here are another network called the Pediatric Pandemic Network, which is also working closely with EMSC. I want to highlight a fantastic resource published by the American Academy of Pediatrics in 2018. This is a freely available family reunification toolkit that provides in-depth planning for pediatric patients and unaccompanied minors in your reunification plan. So check it out. In order to understand the needs of children, we need to understand how children are different than our adult colleagues. The 2 main distinguishing factors are, 1, they are a vulnerable population with age-based developmental differences, which means they have special healthcare needs requiring specialized safety and security, such as baby and toddler safe areas. And 2, they require specialized equipment due to their developmental needs. This includes, but is not limited to, weight-based medication dosing, special foods such as donor breast milk, formula, Pedialyte, as well as special supplies such as diapers, bassinets, cots, and cribs that you wouldn't otherwise think for your other patients. When looking at your reunification plans, consider some key personnel that help with pediatric patients and your unaccompanied minors. Here I've listed many disciplines that are important to incorporate into your plans. I want to emphasize a pediatric champion in your plan, as well as child life services, on-site childcare, and nutritional services. The nutritional services will come in play when you're trying to find food for your pediatric safe area, especially that's appropriate for the development age of the child. Upon the child or unaccompanied minor entering your facility, whether that's in a hospital or in a community, it is important to consider key differences for children versus adults. Of course, you can ask them their basic information like their name, their guardian's name, and their nickname. But depending on the age of the child, they may not be able to provide key demographic information like their phone number or their address. So for those patients, you really want to ask personal questions such as their favorite toy or their pet's name. Ask their school name or their teacher's name. Once you know their school name or their teacher's name, you can then contact that child care facility or school district and get the contact information of their legal guardian. Another tool in your belt is distinguishing marks on the body, what the child was wearing, and what belongings they carried when you saw them. They might have their favorite stuffed animal or a blanket in their hand. When items such as these will help connect the child to the family member because the family member may tell you what object they had with them at the time of the incident. I also want to highlight taking a photo of the child during intake as a way to track the patient. This can be as simple as having a Polaroid camera in your intake equipment. When you're taking the picture, keep this printed picture with the chart so that you have an active photo of the child at all times. Lastly, don't forget to ask about allergies. This will be very important when it comes into providing food in the pediatric safe area. Here is a sample pediatric intake form. It's actually provided by the Minnesota Department of Health and is freely available on their website for you to download. Some other considerations in your intake equipment is using bright wristbands with certain colors that identify unaccompanied minors versus other patients. You can even have a pediatric ambassador that remains with the child throughout their reunification process. If you're using a paper chart, make sure you have either a QR code or some sort of method to integrate that paper chart into your local electronic medical record or even MinTrack, which would be best for all hospitals and facilities in the area. Now, after your intake, family members will also be flooding into your hospital or your community center looking for their missing child. They should be directed to a previously designated area serving as the Family Reunification Center. There are a few considerations when it comes to your family reunification in regards to unaccompanied minors. Most importantly, is that this area is secured and away from the emergency department, the media, and your pediatric safe area. You should have sign in and sign out sheets with the contact information of the family members in case you need to get a hold of them. When doing the family intake, try to get a printed photo of the family member standing next to the missing child so that then you can later match that photo with a previously taken photo that you did on your intake sheet. Try to upload this photo electronically into the electronic medical record or keep it with the chart at all times. Ensure in this Family Reunification Center that you have behavioral health, chaplaincy, interpretive services, restrooms, and food available for the families that are waiting. Lastly, I really want to emphasize having separate private rooms that you can have next to the Family Reunification Center for families to have private discussions with you regarding their missing loved ones. These are some examples on how to confirm identification of your child with their parent and guardian. Every hospital has a standardized protocol already in place that's usually with social work. However, you can see things like this happen every day, especially in your emergency room. However, the problem becomes when the system is overburdened, like that in a large scale incident. So for your reunification planning, you should work closely with social work to have a plan. Here are 4 examples of confirmation. You can use a form of identification, a photograph in which your caregiver is with the child that matches, and you can also use the registration sheets that you took from your intake that matches with the family's registration sheet that they took from the Family Reunification Center. Lastly, and most costly, is using biometrics such as DNA sampling, fingerprinting, and palm printing. This option is usually available by hospitals, but is usually an option after a few days of attempting reunification. Now, what if you're unable to confirm identity of a child, but they are medically cleared and thus no longer need to be in the emergency room or in a medical bed in the hospital? That is when your plan needs to have a pre-designated pediatric safe area. There are 2 types of pediatric safe areas. A short term is having one that's hospital-based operation, which is a secured area away from the emergency room, media coverage, and the Family Reunification Center. And a long-term one, which is a community-based operation, which is usually something that is opened up after a few days of reunification efforts. Both of these areas should be large enough to accommodate all the children, but also provide them age-appropriate activities. So you want to have maybe a movie for the older children, coloring books for the younger ones, and even an area for napping for the infants and toddlers. This area should have a separate and secured restroom with access to food. And as previously mentioned, this should include donor breast milk, formula, Pedialyte. And when you're picking your food, avoid common allergies such as peanuts and tree nuts. This area will also require a pediatric safe area unit leader, which is usually like a child life specialist, a social worker, or even a child care facility worker. Security needs to be at that pediatric safe area at all times. When the child does require long-term pediatric safe area care, you should then contact Child and Family Life Services to be taking temporary custody of the child, and they will continue to work with law enforcement to make sure they can find the legal guardians. The Minnesota Department of Health actually provides an extensive pediatric safe area checklist that you can see here on the top left. This has key considerations for your plan, so I highly recommend taking a look at it. They list things such as covering the outlets in your pediatric safe area for the toddlers, or have an EpiPen available in case someone has an allergic reaction. The bottom left is actually the specific staffing ratios that are required by Minnesota law here in the state of Minnesota. These staffing ratios are divided by age, which is helpful when you're thinking about your staffing needs for your pediatric safe area. Every state has different rules, so it's important for you to take a look at this on the Minnesota website. The top right is an example of a pediatric safe area registration intake sheet, and the bottom right is a running list of unaccompanied minors that are in the pediatric safe area, which should be updated at regular intervals. Once you're able to make a match between the unaccompanied minor and legal guardian, you need to reunite the members. Your reunification plan needs to have a separate reunification site, So this specific place is where the actual reunification occurs. So it should be secured in a way from not only the Family Reunification Center, but also the emergency room, the media, and the pediatric safe area. Bring the child from the pediatric safe area directly to the reunification site and bring the family from the Family Reunification Center to the reunification site. The reason to keep this separate from the actual Family Reunification Center is to prevent further trauma from the families who are still waiting for reunification with their child. When demobilization is occurring from your reunification center, I want you to think about your after action reports when you're debriefing. Consider including the family members, the caregivers, and even the children that were in the reunification process in your debrief. They can provide key ideas and insights into your plan that you may have not thought about, and that would help you for your future. Lastly, I want to bring up a study that I was a part of that was published in Health Security in 2020. The key point from this study is that you don't have to be a pediatric hospital or a pediatric facility to have a developed pediatric reunification plan. All you need are three key components that we found to be better predictors of reunification planning, and that is having a pediatric champion in your plan, having an annual disaster exercise with unaccompanied minors in your plan, and implementing the AAP Reunification Toolkit that I mentioned earlier. With these 3 points, you can have better planning for pediatric reunification. If anyone would like more resources for pediatric disaster planning, this is the ASPR FEMA Region 5 for Kids website, email, LinkedIn, and Twitter. You can scan this QR code and it will take you directly to our main page. Look for links to the website for ASPR FEMA Region 5 for Kids, RAPM, Pediatric Pandemic Network, and the AAP Reunification Toolkit in the description below. Thank you for the opportunity to speak with you regarding pediatric considerations in your reunification planning. Goodbye.